Before I discuss blood pressure, I just want to do a quick review of the heart and specifically talk about atrial contraction and ventricular contraction and relaxation. So remember that we have four chambers. We have two atria. There's the right side, there's the left side. When those atria contract, they will push blood into the ventricles, and yes, they do contract simultaneously. As we're going through atrial contraction, the ventricles are relaxing, so ventricular relaxation. Then the ventricles will contract, pushing the blood to the outside of the heart. And as the ventricles are contracting, the atria will be relaxing. This is important in understanding blood pressure. Okay, so blood pressure is the force of the blood that is exerting on the vessels in which that blood is contained. So we measure blood pressure in millimeters of mercury. Our normal blood pressure would be 120 millimeters of mercury over 80 millimeters of mercury. And how we get these measurements is we use an apparatus called a sphygmomanometer. Yes, that's a hard word to pronounce. And so typically at the doctor's office, you'll see something that looks like this apparatus. They've got this on the wall. They place this cuff that expands and fills with air. And then they've got their stethoscope listening just underneath where that cuff is placed. In class, we'll be using ones that are digital sphygmomanometers that look like this here. So what we're going to do with those is that we're going to place that cuff on and we're going to fill it with air. When we fill it with air, we are going to be placing it around the brachial artery, which is the artery that just runs down your bicep, basically. And we're going to be filling that up with air. And then in a doctor's office, they would be listening for when they begin to hear blood flow back in through that vessel. And so once they hear that swoosh, we know that that ventricle is working really hard and that blood is beginning to flow. That would be your top number. Then the bottom number is obtained when you stop hearing this swish, meaning that the blood isn't having to have pressure against the arteries in order to get that blood flowing through again. It's just flowing in a natural state. So let's break down what those numbers actually mean. So this top number that we get, this is the value we get when those ventricles are contracting, and we call this systole or systolic pressure when those ventricles are contracting. Now remember, when those ventricles are contracting, it means that the atria are relaxing. So the other number, the number on the bottom is called our diastole or our diastolic pressure. So this is when those ventricles are relaxing. So when those ventricles are relaxing, this means that those atria are contracting. Our atria are contracting, and this means that those ventricles are refilling at that point because the atria are pushing the blood into the ventricles. While we're talking about blood pressure, let's just review blood pressure that occurs through the different blood vessels that we've looked at. So reminder, we've looked at arteries, arterioles, capillaries, venules, and veins as it flows in that direction. And specifically looking at this diagram that we've looked at before, here we have blood pressure. So here the blood pressure through the arteries as their own muscles contract and relax, contract and relax. Then it drops off, comes very low in the capillaries, and then really drops off in the veins. So let's put some numbers to this. Blood pressure is highest in the aorta, our largest artery that we have. And that blood pressure is about 140 over 120. Remember that aorta is very thick in order to allow this high blood pressure to pass through it. Then that blood pressure continues to drop as it moves through the arterioles and gets down to about 40 to anywhere to about 10 millimeters of mercury in the capillaries, and then drops and remains very low within those veins. So this is very close to zero. Now remember, Remember that those veins have valves that allow that blood to move forward and not to backflow because of that really low blood pressure. So two conditions associated with different blood pressures are hypertension and hypotension. Now hypertension is high blood pressure, and so this is ongoing high blood pressure, and usually given values of 150 over 100 or 150 over 90. The problems with high blood pressure is that if you have high blood pressure, this is going to strain the heart. Any straining of the heart can lead to a heart attack and possibly or a stroke if it is heading to the brain. Things that can cause hypertension are diet, genetic, stress, age, weight, alcohol consumption, whether you smoke or not. Treatment tends to be vasodilators, getting the blood vessels to be bigger, or diuretics, causing the kidneys to excrete excess salts so that we remove the salts and therefore can decrease the blood pressure and blood volume. Now, hypotension is typically about 100/60 or lower. This value below 100 is typically a low blood pressure. So causes of this could be shock, stress, anemia, blood loss, meaning an injury, and treatment typically depends on what the cause has been. But if it is a natural hypotension, then typically doctors would prescribe an increase of salt in the diet. So there are 7 factors that we're going to look at that would affect blood pressure. Now this will be an increase and a decrease. So with each factor, I will show you what will cause the increase as well as what will cause the decrease. So vessel diameter, I've already talked about vasodilation. So this just means a larger diameter of those blood vessels. And so with a larger diameter, if you can think of this like a hose as you see in this diagram here, if I have a fairly large hole and I turn on the water to a certain speed, that water can trickle out. So it has a larger diameter, and therefore we're going to say that it has a decreased blood pressure. Now on the opposite end, if I now attach a hose that has a smaller diameter, but yet I keep up the same amount, the same volume of water that is coming out of that hose, that water is going to come out at a much faster rate. And so this is analogous to the increase in the blood pressure. If we have vasoconstriction, which means the tightening of the arteries, then we're going to have an increased blood pressure. Now, our brain can monitor blood pressure and control the size of our arteries. So this actually does happen, that we have arteries that they'll go through vasodilation as well as vasoconstriction. The second factor we're talking about is blood viscosity. So this just means blood thickness. So what I like to use for this is thinking about trying to push some sort of liquid through a syringe. If I have really thick blood, think of this as like syrup. If you're trying to push syrup through a syringe, through a needle, because it has decreased water amount, it's going to be very difficult. You're going to need a lot of force to push that blood through, to push that syrup through. Therefore, you have an increased blood pressure because you have to exert so much force to get that through. If you have thin blood, which means therefore you've got a lot, let me erase that there. You have got a lot of water within your blood. Therefore, it is has a lot of volume and is quite runny. You're going to have a decrease of blood pressure. So this is like pushing water through a syringe. That's going to flow much easier than trying to push the syrup through a syringe. The third factor is vessel elasticity. So if you see here, this blood pressure, 120/80, we already said that was normal. So we would expect this individual, their blood vessels to be healthy. So they would have nice elastic blood vessels and therefore a lower blood pressure. And the reason why our blood vessels do have that elasticity, especially those arteries, is that so we want to be able to handle that systolic pressure. And remember that systolic pressure is talking about ventricular contraction. So when those ventricles are giving that big push to get that blood out of the heart. Now on the other end, if we have hardened vessels or vessels that have some sort of buildup, then we're going to have higher blood pressure. So here would be the example of arteriosclerosis. So arteriosclerosis is just the general term for when artery walls, they lose elasticity or thicken. So you lose elasticity or thicken. Now, a certain type of arteriosclerosis is atherosclerosis. Now, atherosclerosis is that when we actually get the buildup of fatty substances, buildup of fatty materials. Most often, this fatty material is that cholesterol that builds up. So those who are experiencing high blood pressure are often put on a low cholesterol diet because we don't want to add to the possibility of depositing these fatty materials within their blood vessels. So these deposits are often called plaque buildups. So they are plaque. And what happens is that these blood vessels, these deposits here, they're very sticky. So one that's stationary is called a thrombus. But if this plaque buildup picks up and begins to move, we call it an embolus. And if that embolus actually begins to stick to other things and actually causes the blocking of a blood vessel, then what we have is an embolism. Anything after the embolism in terms of where the blood was flowing, that tissue will die. If it's leading to the brain, it will cause a stroke. If it's leading to the heart, it will cause a heart attack. The fourth factor that affects blood pressure is blood volume. Now, in this first one, I've said sweat a lot, but I should probably explain this a little bit more. This is excessive. So both of these, when we're looking at them, both of these are typically short term. So if there has been excessive loss of water through sweating, you'll have a decreased blood volume. If you have less of a blood volume, it means you'll have a decreased blood pressure in the short term. If we have diets that are high in salts, that will lead to an increase in volume. An increase in blood volume will lead to an increase of blood pressure. Now, this can obviously be corrected by changing your diet so that it is not high in salts. Our fifth type of a factor that affects blood pressure is the cardiac output. So if we have a high heart rate, this is going to increase blood pressure. And if we have a low heart rate, that is going to decrease blood pressure. So this cardiac output is normally achieved through activity. As you increase your heart rate, you increase blood pressure. Again, this is most often going to be short term, but if your heart has to be working harder in order to pump that blood because of vasoconstriction or because of plaque buildup, you are going to have a natural high heart rate and therefore an ongoing increased blood pressure. So again, that heart is going to have to work harder. When the heart has to work harder, it is a muscle. It may tire and therefore it can lead to other things that can cause significant issues within your body. And our last two factors are age and stress. So when we are young, as most of our cells and tissues in our body, they are nice and healthy. So these are elastic blood vessels. They tend to be able to be stretched a little bit more. Those arteries can really work those muscles. So therefore, when we are younger, we naturally have a lower blood pressure. As we get older, our blood vessels have this natural inelasticity to them. So they're inelastic, which means they don't stretch as nicely. So because of that natural inelastic aging process, therefore we have an increase in blood pressure. And our very last factor is talking about stress. Now, I'm not sure if any of you have ever heard about that there are people in high stress jobs that end up having heart attacks, but yet they might be active, they might be physically fit. The problem with this is, again, our system, our brain can control if our blood vessels are constricting or if they're relaxing. Stress, adding to the sympathetic nervous system, causes vasoconstriction. And so that vasoconstriction gets that blood to pump quite a bit faster. Therefore, it causes an increase in blood pressure. Whereas normal vessels, under normal conditions, not stressful conditions, will decrease the blood pressure. So that's the end of this podcast on blood pressure within the circulatory system. Please go to your Vodcast e-assignment and finish that and be ready to discuss this in a little bit more detail tomorrow.